Hello, my name is Joe from Denver Public Health. May I please speak with Vicente Lopez? I need to discuss some important health information. Before we continue, can you please confirm I'm talking to the right person by confirming your date of birth?
Yeah, what is this about?
I'm calling from Denver Public Health about some health information, specifically about an office visit on January 5th. The reason we ask for your birth date is to make sure I'm talking to the correct person, which protects your confidentiality.
Okay, I don't really understand why you're calling me though.
Thanks for being upfront about that, Vicente. I understand this kind of call can be confusing, but I want you to know that it's my job to protect your confidentiality. What we talk about will not be shared with anyone outside of the health department. If you would like, you can just share the month and date of your birthday.
Just to make sure this isn't going to be shared with any type of enforcement, will it?
No, it's not shared with any agencies involved with federal public benefits or immigration, if that's a concern.
Okay. It's August 22nd.
Thank you, Vicente. The reason we're calling is to help stop the spread of COVID, and we believe you can help. This call is voluntary, but by sharing your experience, and you are helping us learn more about COVID 19 so that we might protect others from it and take care of your health. This call can take about 15 minutes. Is it okay to proceed?
Yeah, sure, that's fine.
Thanks so much. I see your preferred language is English. Is that correct?
Yep, I pretty much only speak English outside of my house.
Thank you. Have you gotten the results from your COVID 19 test?
Yeah, they called me and said that I was positive, and they gave me some information and told me to stay at home.
I'm glad they contacted you already. That's important information. How are you handling the news?
I don't feel too sick.
I'm glad you're feeling okay. How are you coping with staying at home?
That's been pretty tough. I'm a postal worker, and when I started coughing, I stayed home.
I see. Can you tell me more about your living situation?
Sure. I live with my girlfriend Veronica and her parents and her grandmother. When the pandemic hit, Veronica's dad lost his two jobs. On top of that, Veronica had to quit her job at City Hall to take care of her stepmother who has diabetes and her grandmother. So we're kind of in a position where every dollar we can get counts.
Wow, seems like you're trying to figure things out even before you got sick.
Yeah, and Veronica has to stay healthy. She does everything here. She cooks, she cleans, and now she's helping the kids with their online school, and she does the best that she can. Um, Sometimes our oldest even asks like when everything will go back to normal, but we have to let her know that we don't really know, and it's not going to happen right now.
I see. That's a lot to deal with right now. I'm glad we've reached out to you. We contact everyone who tests positive because we want to offer support to help you and your family manage this and take care of your health. Know that what we talk about is confidential and will remain private. We may use information that you provide to reach out to others who might benefit from testing or other recommendations, but we will not share your personal information with them. Is it okay to proceed?
Yeah, that's fine. I really just don't know what to do.
It is a very difficult time right now, and it sounds like you're already supporting your family in every way you can. Do you mind telling me what you know about COVID?
Um, well, I know it's everywhere. In our neighborhood, we have a lot of family members living together, and it's really hard to stay away from each other. In our house, we have five adults and two kids in the house. We go only to the clinic, really, and they've been pretty helpful. They even gave us a glucometer to check Veronica's stepmom's blood sugar levels. But it feels like when you solve one problem, there's another, and it just feels like a lot of stress.
Yeah, thank you for explaining, Vicente. Let's work together to make this more manageable and less stressful. What would you say is your biggest concern right now?
Probably that COVID is most dangerous for older people. And Veronica's grandmother lives with us, and I'm scared she might get it.
What's grandmother's name?
Maria.
Sounds like keeping Maria healthy is the biggest concern. We can talk about ways to do that. Does your family know that you tested positive?
Yes, they know. I played them a Spanish language video that the health worker at the clinic gave us, because it seems like if you don't know English, it's going to be really hard to understand what COVID really is and what it does.
That's great. To protect Maria and the rest of your family, I'd like to share some info about COVID-19. Is that okay?
Yeah, that's okay.
First, Vicente, it's not your fault that you got sick. And the more your family knows about it, the more you can all work together to get through this. COVID can cause many symptoms, but it usually affects the respiratory system, causing a fever and cough. It can spread from person to person when they cough, breathe, or sneeze, including if they cough or sneeze on a surface that other people may then touch. So COVID-19 spreads easily through close contact with other people. Luckily, many cases are mild or moderate, and most people don't need to be hospitalized. Some cases can get more serious and cause pneumonia and breathing difficulties. Based on that information, what questions do you have about COVID-19?
I've heard that some people don't show symptoms when they have it. Is it possible that the other people in our house already have it?
That's a great question. Getting a test is the only certain way to know if somebody has COVID-19. Do you mind if we talk about you first and then your family? As we talk, please let me know if there's anything you don't understand or anything you want me to explain in more detail. Next, the case investigator would ask Vicente the case information, such as contact information, mailing address, demographics, and then we would move on to the clinical information section. Vicente and I would go over the list of symptoms and the onset date. Thanks for going through that symptom list. It is lengthy. When did you first notice your symptoms starting?
It was probably a couple days before my test, so around New Year's Day.
All right, let's both look at a calendar, and please tell me exactly when your symptoms started.
Okay, looking at the calendar, it was probably January 2nd. I remember thinking that maybe I had just a really bad hangover, but it felt a lot worse, like the flu, but with more aches.
Okay, Vicente, thanks for clarifying. We have that the date you took your test was on January 5th. Is that correct?
Yes,
Have your symptoms improved?
they're getting better, but I'm still not at 100%.
Thank you so much for taking the time to go through all of this with me. Anybody who tests positive for COVID-19 needs to be careful not to infect others. So it's very important that you follow these instructions and stay away from others. This is called isolation. You may end isolation when at least 10 days have passed since your symptoms began and at least 24 hours have passed since you had any fever without the use of fever-reducing medications, and your symptoms have improved. This is the window of time to reduce the spread of COVID-19. Let's calculate what day that will be for you. You mentioned your symptoms started January 2nd, so 10 days from then will be January 12th, and you could potentially end your isolation then. Please make sure at least 24 hours have passed with no fever, without using fever-reducing medications, and ensure that other symptoms have improved. Do you have any questions?
No, I don't think so.
Isolating normally means staying in a room by yourself as much as possible. That may not be possible for you, correct?
That's correct. We only have 2 bedrooms, but we also use a pull-out couch in the living room.
Okay, let's come up with ways to make sure you have as little contact with your family as possible, especially Maria. What have you been doing to keep distance since you started having symptoms?
I sleep out on the pull-out by myself.
And Veronica takes care of the household and the kids.
Yes.
That is helpful. Could you create a visible space for yourself, maybe by hanging a blanket or a sheet by a window if possible? Something to remind everyone that you're kind of in a no contact zone.
Yeah, I can do that.
And you have one bathroom?
Yes.
We recommend that you disinfect the bathroom after every use and wash your hands with soap for at least 20 seconds. And please have everyone wear a mask and stay 6 feet apart as much as possible.
Wow, this is hard. I know Maria is at high risk. Is there any place I could stay for a while?
Some communities have public health hotel rooms. We have a resource coordinator who could follow up with you on that. I'd also like to send you a copy of safety recommendations. It is usually easiest to share this information via email. Can I send you the information to your email?
Yeah, that would be helpful.
Okay, now back to something you said before. You mentioned a clinic. What is the name of your clinic?
It's called Mejor Clinic.
Okay, the clinic is going to be very helpful in helping you keep your family safe. From what you've told me, every member of your family may be what we call a close contact. Does the clinic offer free testing?
Yeah, they do. They're the ones that did my test.
Would you be willing to call the clinic about your family situation?
Yeah, and I really like my doctor. She listens and has given me good advice so far.
All right. Thanks for being willing to do that. The rest of your family may need a COVID test. The clinic can tell you exactly what is needed. They can give you medical advice and check to make sure your symptoms keep improving and that you are healthy. If one of your family members tests positive, they should do a 10-day isolation period like you. If they don't test positive or they don't get tested, they should do what we call quarantine. This means they should stay home and avoid outside activities like going to work or the grocery store or being with other people. They should monitor themselves for symptoms. If they develop symptoms, they should end quarantine and begin isolation. As we said before, isolation can end in 10 days after they develop symptoms if they have no fever for 24 hours without using medication to reduce the fever and their symptoms are getting better.
Man, this is a lot. I'm afraid of what will happen if somebody else tests positive.
It is a lot to absorb. It sounds like you're already taking some important steps to take care of your family. I'd like to collect some more information so we can follow up with your family. Would that be okay? Vicente provides information about the other family members. Maria and Veronica's dad speak Spanish as their primary language. When asked about people he might have infected prior to developing symptoms, Vicente says he will not provide information about the contacts he had. I can provide this information anonymously to a team of colleagues. They will reach out to the close contacts and make sure that they have the support they need to quarantine for 14 days and monitor their symptoms. Your information will be kept confidential and your name will not be shared. We do this to keep others healthy and safe.
No, like I said, I don't want to give you information about other people.
Please help me understand your concern better.
Well, it's just that not everybody feels comfortable with the government or calls like this. I bet if they saw the health department calling, they wouldn't even pick up the phone. I won't share their information. I don't know how they might be affected if I do.
You're right, it's possible they might not pick up the phone, but if we reach them, we can offer support. Again, this information wouldn't be shared with anyone outside of the health department.
Can I just tell them? That's as far as I'll go.
Yes, I understand. We trust that you will make the right choice and share the information about quarantine. You can also give them our number to call if they have any questions or can use some support. I can send you written information about quarantine via email too.
That works for me.
Okay, let's practice. Please tell me what you're going to tell each contact.
Well, I'll tell them that I have COVID and may have passed it on to them.
Vicente and I review what he will tell his contacts. As guidance around quarantine continues to evolve, please be sure to check with your local agency for more information regarding quarantine instructions. Please follow your local health jurisdiction and/or agency guidelines. We are almost done. I know we are asking you to stay home for a long time. Do you have any concerns or hardships you will face while isolating?
I'm really worried about missing work, and my family doesn't have health insurance. Is there anything you can do to help with that?
Yes, we will email an isolation order that you can share with your employer if you feel comfortable. It gives your positive test date and notes that you must isolate for 10 days. In Colorado, we have a public health order saying that no one can be fired because of a positive test result and having to isolate.
Well, that's good. If someone in my family has to go to the hospital, we don't really have the money or insurance to pay for it, though.
We recommend you contact the clinic if anyone has health concerns or if your symptoms get worse. They can refer you if anything more serious is needed. Regarding financial and insurance concerns, we have a staff who can follow up with you about resources that you might need. Are you comfortable if we do that?
Yeah, that would be great.
Thank you for sharing your concerns. If you need immediate help, you can call Colorado COVID Hotline at 211 or visit www.211colorado.org to connect with a resource navigator who may be able to help you.
Okay, that would be helpful. Thank you.
Thanks for taking the time to speak with me, Vicente. I really appreciate it. Before we end our call, what remaining questions do you have for me?
I think you answered them all. Thank you so much.